Hi, this is Rita, and this is part 2 of the first video I did, and we'll be following up more about sickle cell. Let's talk about the challenge in the symptoms of sickle cell blood disorder. Talking about signs and symptoms. Living with sickle cell isn't just about pain, it is a full body challenge, a full body health challenge. From one painful episode to another for the rest of your life. It is very, very challenging. People with sickle cell blood disorder experience painful episodes called crisis. So whenever you see somebody in a full-blown crisis, know they're experiencing pain episodes in the worst possible kind of way. These episodes are in various dimensions. Sometimes it will warn you, sometimes it doesn't warn you, it just embarrasses you. Like all of a sudden, boom, 1 minute you're fine, the next minute you're crawling, you're gasping for air, you lost mobility. It's just like that, something like that. It's very, very challenging. They experience chronic fatigue due to anemia, the constant loss of blood. So they always experience a lot of fatigue. And for the females with the sickle cell blood disorder, when that kid gets to about adolescent age where they start experiencing menstruation, it becomes more challenging because every time they menstruate, they'll likely go into crisis and they'll likely have blood transfusion because of the loss of blood. It will cause them fatigue, cause them anemia, cause them to get transfusion, and causes pain. So the normal pain that comes with menstruation for them is times 2, because not just the menstruation pain anymore, crisis added to it too. So it makes it more challenging for females with sickle cell blood disorder that are experiencing menstruation during their lifetime. This anemia, this pain, let's say it is characterized by swollen inflammation of parts of the body. So most often than not, when they go into crisis, the crisis end up developing the inflammation in parts of the body. The common places are hands and legs, but the swelling can happen in any part of the body. Most of the times it's the generalized pain, and then the pain will choose a particular part of the body to localize on the area, and when it does, that particular area swells up. Sometimes it's just your arm, sometimes it's your legs, sometimes it's your head. If the crisis decides to localize on your head will swell up. Sometimes it's just the whole body, you feel numb. That's another part of crisis too. So it's in different categories and different levels of pain. Sometimes I ask you, is it a stabbing pain? Is it a throbbing pain? Is it needle and pain? It is all of the pain combined together that they experience. So yeah, it is very, very challenging. Another sign and symptoms that people with sickle cell blood disorder experience is frequent infection. How does infection come into the picture? When pain lingers in the body for too long and is not treated, like handled with urgency, it leaves room for infection to set in. So that's why most of the time people with sickle cell blood disorder, when they experience painful episodes, they're more likely are prone to infection. And the infection can be in so many variations and dimensions. Most of them experience a lot of abscesses from various parts of the body. Sometimes it's infection through the blood. So that's why it's advisable if any person going through crisis, handle that crisis immediately. Handle that pain immediately, because if it stays too long in the body, it will give room for infection. And sometimes when the pain takes a longer time to go, meaning infection is inside. So always check for infection, and you treat with painkillers as well as medication for the infection. That will help clear out the pain and whatever is going on very faster. And also another symptom is delayed growth in children. Most people, why we emphasize or insist on people to know their genotype, is to prevent all of this. You will not like to see your kids suffer, and you will not like to suffer as a result of your kids suffering. But for those of you who have already made that mistake, maybe ignorantly or you did it consciously, take care of your kid very well. If you take good care of your kid, they will not have to experience delayed growth. They will grow up like every other normal kid and grow up very well and blossom like they're supposed to. But when care is lacking, they will tend to have retarded growth as kids, and they will grow up in like manner. So it is very important for people with sickle cell disease children, take very good care of your children to prevent delayed growth. In addition to what I just said, when it comes to sickle cell, it is not just physical. Like I said, it's not just physical, it affects emotional and mental health too. So if you know anyone with this blood disorder, be nice and be kind. Also be understanding of these circumstances and stay informed. It's very important. Thank you.